A lot of people don't believe in the medical world that we can sell value beyond what insurance companies pay us for, whether we're chiropractors, physical therapists, podiatrists, pain management doctors, anything in the musculoskeletal field, or even nurse practitioners, anybody that's treating a patient who comes in with a complaint of joint pain or some sort of a neural entrapment syndrome, you can help them. It's just that you choose to continue using traditional modalities, or if you're a physician, give them pills and injections. There is the most amazing technology that I've seen in my 20 plus years of practice as a doctor of physical therapy, an expert in neuromusculoskeletal health, and in the non-surgical realm, which is class 4 deep tissue, high intensity laser. And I just wanted to show anyone that's watching this video that this is the real deal. This is not a joke when I say that we're charging cash for this service, and people are willing, able, and are excited to pay for it and are getting results. I'm not saying that lightly. So take a look here. I'm going to show you a couple of cases, different age groups that are doing really well with the laser, so that you can see that we are actually doing what we say we can do here. Here's an example of a patient. Last name is Weiss. He's a self-pay. He came in without insurance a couple weeks back. He's a young man with Osgood-Schlatter's disease. So he's got patellar tendon and patellar tuberosity pain. For a long time, he's tried ice and all these other things, and nothing seemed to help. He came in, he was skeptical. He had bad insurance at 19 years old, and his parents brought him in, and he gave it a run. And you could see, his age right here. And yes, you could see this is in the month of February to March of this year, 2021. So during the COVID time, you could see his first visit. It is January 22nd, 2021, where he came in to just kind of figure out if this was the right solution. We charged him $140 to get an exam and laser treatment to his knee. Came back 2 days later, told us it helped. He was still on the fence. We told him, go home and do your old treatment and see if you can get rid of your problem. It didn't go away. Comes back with his parents, drops $750 on the table. This is the truth. This is our billing platform. There he is again, Weiss. And there you go, what he's worth to us. 6 sessions of laser. And he said, I feel wonderful with the treatment. And he was super happy. And he sent his father to us, who paid us $375 for a consultation with laser as well for something else. Isn't that amazing? So that's our first client, just to show you. So here's another client over here, Sotaris, I think his name is, last name. Read an article about laser in the local paper that we wrote. Came in on 2/17. He's a Medicare patient, bilateral knee pain. Paid us cash, $97 to just get an exam and see if the laser is right for him. Comes back, walks back into the clinic with a credit card a little bit later and drops $300 on the table for a packet of lasers at $750 for 6 sessions more. So there you go. 300 plus 450 is 6 sessions more. Do the mathematics there. And he bought a packet of lasers so that he can continue the services. Now he became a Medicare patient, and there he is again. You can see he's Medicare, and now he's a Medicare patient in our clinic. Mr. Sotaris came in for a laser test on 2/17, ended up buying a package. This is my staff writing this stuff, okay, on 2/19, and then he made a final payment here, and then he decided to become a Medicare patient. So this patient, you can do the mathematics. Reimbursement for a physical therapist in New York State on the Medicare side is like, I don't know, like $80. So, $80 times, let's say he comes 10 more times for the Medicare conservative low, that's $800 plus the $750 plus the $97. This guy is worth to us over $1,600. Now that is a profitable, good patient, right? I play this game all day long, and the patient is super, super happy. He was going to go get knee replacements, and he's very happy with our services. Here's another patient, a patient named Hannah. She decided she had a meniscal tear and was going to go get surgery, wasn't sure. We examined her. She's a Medicaid patient, 48 years old, can't walk, called us up, heard about us, and decided to come in and give it a run. Again, she's Medicaid, so you would think, she doesn't want to pay money, right? Psychologically. Well, that's wrong. And she decided to come in and she purchased the package of $750. Can you see that right here? And she dropped the money on the table. And this is during COVID time. You see the date here, 3/3. We're not playing games here. These are real patients getting real results. She was so happy. Sent her back to the doctor, and the doctor themselves, the sports medicine physician, who's a physiatrist, examined her again and said, listen, keep doing laser on her, told her to continue. There she is again, Goldman. And you can see, told her to continue with the laser to even buffer what we told her. So she was even more excited. Now she's sending her friend to us. So you can see the dates of service. So we're telling you what happened here. You can see the credit card payment on 111, 113 of 300. So she came to try it at 75. She paid 300, then 150 plus 300. Can you do the math? That's 750 plus 75 right there. And she came 6 times. And we helped her tremendously, and she's writing us a great review. Here's another patient. Look at her age. Her husband came in for laser. I didn't have time to cut all these out of my billing platform and show you guys, but her husband came in to treatment right over here, and her husband sent her. He was coming for a meniscal tear. Her name is Weinheiber, and you could see we gave her a free laser trial because her husband was a client. And then look what it said. She signed up for the laser package of $750 on 2/15. So February 9th with free, and then she signs up on 2/15 for a $750 package. This lady is Medicare. Can you see that? And then, and since Medicare, it does not cover laser, she was willing to pay for it. Mrs. Wenner paid the remaining balance 3/8 today. So she paid the remaining balance. So we let people pay off the balance, because we want them to not feel the pressure. But this lady is now also a Medicare patient, so she's going to come under Medicare and laser. So we're not just treating her through laser, we're treating her through Medicare. Can you understand that this patient is a lot more valuable to us than a typical Medicare patient? I think you can figure that out at $80 for Medicare. So let me go through the next one. This patient over here, you can see Zentronenbaum. She paid us these 2 red arrows here, cash. It's hard to see this because it's small. See if I can zoom in for you here. 3/7/2021. That's $650. She paid us cash, green paper. Over here, cash again. That's $200. Over here, $650. So she bought a package here. She paid her deductible for Medicare on 112 over here. This was 2020, 10/22/2020. $650 for a packet of 6 lasers for her neck problem. Here she paid for her deductible $203 for January 2021, and then again $650. Just bought a package on 3/7/2021. She started out by one test to see if the laser was right for her at $70. So there you go. She's a client of ours and very happy as well. And she came asking for the laser herself. She's a Medicare patient. Let's see if we can go and find you another one here, guys. So let's see here. There she is again. Sorry. She's 70 years old. You can see she's Medicare. And look what it says. Again, she paid $650. Mrs. Z paid $650 in full for a packet on 10/22. She paid her deductible, and then she was evaluated on 110. And then, so she's a Medicare and laser patient. She's doing both. Can you just imagine what she's worth to us? $650 for another packet. So this lady is worth over $2,000 to the company. Lifetime value of a customer. Here's another patient, Mr. Semanyov. You can see here the date, 3/3/2021. This guy's 46 years old. Look at the different ages. He's Aetna. He paid $75 to taste the laser, to try it, okay? 6 visits of laser package. Do you see that? Okay. These are my staff writing. He paid for another package today at $750. This guy paid for 2 packages. Okay. He's worth 14. This guy is worth plus Aetna. So can you imagine this guy's worth over 2 G's to the company? Unbelievable. You know, like I don't understand why everybody's so scared to sell value to their patient. So he has a $60 copay, and we just basically rolled it into the deal, right? So you can do that. I'm sure that's one of the objections you have, and go, but what if they have a high copay? Okay, so take the copay. You're taking it up front when you sell them a package, right? So you basically adding value to the patient. The patient doesn't want your doctor's service or your physical therapy service. To them, that's a commodity. What they want is they want fast improvement results. So here's Mr. Semaniov again. I'm just showing you his age, 46 years old. And this is right now during here, okay? Mr. Semaniov. Is that Mr. Semaniov here? Am I? Yep, Mr. Semaniov. You see that right there? Look at that. You can see 2.2, $60. Then he bought a packet, like I said, 2.2, $725 for 6 sessions. Boom. He paid a copay because he was out of his packet range. At $216, he used up all his, lasers. Boom. And he decided, I'm going to get another one. Now, his case is this guy has a problem with his labrum, and he's got a tear of his labrum, and it's very inflamed. And he's got bursitis of his shoulder, and he wants to be able to use his arm, and he's got to the point where he's considering a shoulder surgery, but he decided based on his MRI that he wants to try conservative management, and he's doing really, really well. Obviously, he wouldn't buy all this laser from us, right? One PRP shot is, going to cost him a pretty penny, maybe like, $1,700 or whatever. So there you go. If you're still on the fence about considering a laser, I think you really should consider it. The way we work it with Berman Medical Lasers is we don't just give you a laser. We give you a opportunity to add a profit center to your company. We coach you in the proper way to attract and retain your client. If you're a podiatric physician, our lasers can even work for nails. There's a protocol to help patients with fungal nail. Patients are demanding these treatments. They don't want surgeries. They want approaches that are fast and can get results. I've gotten amazing results with my patients, and I'd love to share those things with you guys. This is my client here, and he came in for, you can see, laser treatments to his knee. And you're 70-something years old, right?
Yes.
Okay, so you started to feel pain inside your knee here, right? And outside here?
Yes.
And you went to the doctor, you told me, and you had shots.
Yes.
So did the shots help you?
Nothing.
Nothing. Okay. He gave you the cortisone shots, the hyaluronic injections, and you told me today, right?
Yes.
I didn't pay you, I didn't ask you for anything.
Nothing.
You told me how happy you were, right?
Yes.
So all we did was shoot this device. So we did lasers on him. We have a class 4 deep tissue laser, which is a device that pushes the fluid outside of the knee. And we did it the 3rd time.
I feel me better because I feel that I don't feel the pain when I am walking, and I feel that it's possible to go down and go up without
squatting. You mean
yes.
Going up and down the squatting?
Squatting, and my knee is very different.
So we'll see after 3 more times if you still need the cane. Now, how long are you walking with the cane for? How many months are you walking with the cane?
8 months.
How far can you walk now with the cane?
With the
How far can you walk? 1 block, 2 blocks?
2 blocks, not too much.
Not too much.
Not too much.
Okay, so we're gonna see if you can walk more distances after we finish with the laser treatments, which we have a few more.
I came in here limping. I had my first treatment, and when I went back out, I was walking straight. I wasn't limping anymore. And I have not limped since then till now.
Is this a true story?
Yes, it is a true story. And I'm feeling great so far. And I would recommend it to the world. I've tried several doctors and there was no relief. So I said, you know what? It is my health. I'm going to pay my money and give it a try.
Was it worth the money?
Pardon me?
Was it worth the investment?
Of course it did.
My toes were like in boiling fire.
When you first came, what was the scale of 1 to 10 of the boiling fire sensation? 9 out of 10. And now?
Now I'd say it's about 6.
6. So like a 40% improvement.
To me, it's like 1,000% improvement.
Just literally walked in from your primary doctor's office, and what did you say to me?
He's known me for quite a while.
Yep.
And I was telling him how different I feel.
And so what do you have to say about that?
I can't believe it.
He couldn't believe it. Now, where was your arm before the laser started? Where was your arm? How far could you move your arm before you started to feel the pain?
This is level.
This level. So she could only move her arm this level, even with physical therapy at our center, before the laser, correct?
Yes.
And after we started doing the laser,
I start to make it higher.
and now?
I can make, because it's before, when I start to make it with this exercise,
Sure.
sometimes pain
Yeah.
started and I cannot put my
You couldn't
arm
put your arm down?
And I use it my second arm and slowly put down. But right now I can make it exercise free.
It's pretty amazing.
I can back to work, I can work without any pain, I can sleep my left side, I can turn.
You can sleep on your left side without pain, no problem.
Yes.
It's the right shoulder that's given me a lot of problems. There's very limited range of motion. I had bilateral rotator cuff surgery.
Let me see how much bar you can bring the arms back when you do a squat.
I can hold the bar back here.
Yeah.
So I could do like.
Your squat, yeah.
Right. I have to kind of set it up.
Yep.
And just go like.
You go like that because you can't bring your arms behind you. Just lift up both arms. Okay, lift up the right arm as high as you can. Lift up the left arm as high as you can. Okay, let's see the left arm. Okay, so you're limited in both arms. Okay, I'm gonna push you with my hand. Okay, hold strong. Does that hurt? Yeah. Do it again. Feels weak. Okay. Have you ever tried laser treatment before?
No.
So this is your first laser treatment,
Yes.
ever?
Yeah.
I'm working on the neck. I'm working on the trigger points in the supraspinatus muscle, the infraspinatus muscle right here, where the rotator cuff emanate and come from, and then the capsule right up in there, the subscapularis area right there. How'd that feel?
Feels good.
Let's take a look. Try to lift up your arm. All I did was laser. Wow, the range of movement looks great. How's the pain level now? Got more power. Hold strong. How's the pain level with that?
Good.
Hey, this is great. I'm here for visit number 5, and my knee is only a little better. I was a little funny. After the 4th one, I had a little bit of pain from the exercise. I was wondering what's going on here. But next day I woke up and I'm jumping around.
So now you have more strength to do certain things?
More strength, more flexibility rather, more ability of moving the knee.
I used to just pick up quickly what I need and hit the register, bracing sometimes because my knee is so stiff and painful.
Mm-hmm.
Sometimes I look around to see if there's a place I could sit down.
Okay, and now this is the 3rd laser. Do you still need to look around and look for a place to sit down?
No,
No more. Really? Honestly.
honestly.
You stopped having to sit down. You're able to...
walk around and I'm on no medication.
I don't believe you.
You can believe me because I'm not taking any medication.
Did somebody pay you to say this?
No,
Did I pay you to say this?
no.
So why are you saying this?
Because it's the truth.
And yes, it lasts. It's not some like overnight success and then the patient comes back complaining, give me back my money. It's not that way. If you strengthen the knee and you work on the quads and the patellofemoral joint and you improve the mechanics of the patellofemoral joint and the gluteus medius and improving the mechanics through the whole leg, the patient will get the fluid out of that knee. So you anchor to something like a PRP shot and you say, I understand the PRP shot is something you are desiring, Mr. Jones, but the PRP shot's going to cost you between, $1,000 to $1,300 for one shot. I've had a PRP shot. Okay, PRP shots are fantastic for the right patient at the right time. If you're a 40-year-old patient with an MCL sprain, the laser and it's acute, the laser probably won't be as good as a PRP shot. I know because I was that patient. So I could tell you right now, I've tried it on myself for an acute MCL sprain after a surfing injury, surfing simulating injury, and I did not get the result. But if it's a chronic inflammatory joint that is overloaded from running or from overwork because your hip is weak and you're overloading your patellofemoral joint and it hurts when you're climbing stairs, going up and down, yes, the laser is going to be magic. Frozen shoulders, magic, magic, magic. Rotator cuff impingements, magic, magic, magic. Bicipital tendonitis, magic. I've seen it work amazingly on Achilles tendinopathies, Achilles tendonitis. Plantar fasciitis, if it's truly a plantar fasciitis, magic. If it's a heel spur, which is probably plantar fasciitis, magic. Small fiber neuropathies, if very effective, but you need to try other types of higher level exercises with those patients to oxygenate the tissues if you're a podiatrist and you're working with small fiber neuropathy. So there are protocols. We coach you in the protocols. I personally will show you my process. I personally will give you my ads, and it depends on the market that you're in, and drive the traffic to you, whether it be a workshop or you want to run ads in the paper or you want to do Facebook, whatever it is. I will give you those ads, show you can generate the leads, and provide you with laser training for your staff and coaching on how to sell it. I don't know of any other laser company that will give you soup to nuts on the protocols, the clinical side, and the sales side like Berman Medical Lasers. Not all lasers are built the same. And I can tell you what's great about the Berman Medical Lasers is that they're agnostic. Agnostic means Berman is just a brand, right? It's all about the engine of the Berman Medical Laser and the diode size. Having a large diode and pushing 20 watts out of a 30 watt diode, or the thing that pushes out the power, is the secret sauce to preventing your laser from overheating, preventing your laser from burning out, and keeping that laser doing its job and pushing the energy through the tissue in a very consistent fashion. Our lasers can throttle up from, we can throttle it up from 10 watts to 60 watts, just like driving a car that's a very fast car, because we can drive it faster and use it at a higher wattage or take it down using just a code. Other companies can't do that with their lasers. You're stuck at 25 watts. You're stuck driving 25 miles an hour. What if you want to drive faster? What if you're in the room and you need to shoot 60 watts or 40 watts at somebody because they're a small fiber neuropathy and you need to give them a ton of joules per second, and you can't because you don't have the time, you'll be stuck at 20 watts. You're not going to be able to give them the changes that they want to be making. And you know what? Your time is valuable and time is money. As a doctor, I can tell you sometimes I just can't wait to get out of the room because I need to move on to my next laser patient. So I think you should consider going with a Berman Medical Laser trial. And we do a trial for certain people at a certain amount of time to show you what it's all about. And then you can make a better decision and to see if this is the right solution for you. I'm happy to get on the phone with you. I'm passionate about training other doctors in lasers because it's changed the way I practice, and it's saved my practice from being a run-of-the-mill breaking even practice to a very profitable, respected, and superior practice in my locale. And I'm proud to work with Berman Medical Lasers, and I would like to do the same for you. So just give us a call. Check us out on the web at Berman Medical Lasers. Thank you.